Welcome back, everybody. This Week in America on the Blue Funk Broadcasting Radio Network. Great to have you with us on the program today. As mentioned, our guest on the show is Dr. Kevin Ryan, board certified in internal medicine, hematology, and oncology, retired, decorated full colonel for the U.S. Air Force, and author of the new book and an excellent book called When a Tumor is the Rumor and Cancer is the Answer, a comprehensive text for newly diagnosed cancer patients and their families. Dr. Ryan, welcome to This Week in America. Great to have you with us on the show.
Oh, thank you very much. I hope we have a chance in our time here to reach out to those literally over 12 million people who are either touched by cancer as newly diagnosed, presently diagnosed, and, of course, their family and loved ones.
Well, and you take everybody from the very beginning, and we'll talk about this in a second, when you sort of think maybe there's a problem and I go to the doctor and they run tests and you go through that whole period of anxiety, all the way up through how it concludes. And in the meantime, talking about people that aren't the cancer patient, but family and friends, and we never know quite what to say or how to act as well. I say comprehensive, and that's in the title, a comprehensive text for newly diagnosed patients and the cancer patients and their families. That really is the case. Well, let's go back to the very beginning and the emotions that we go through when the doctor first starts talking to us and we feel like, it's possible that a tumor is the rumor.
Yeah, exactly right. If I can, let me use a metaphor that I use when teaching my patients. And imagine two clans of primitive man, both inside of a cave. One is just completely fraught and caught by anxiety because they know there's predators outside. They don't know what they are, they don't know where they are, but they know they've got to be there, and they never leave the cave. They don't survive. The other, sitting in a different cave, says, I know they're out there. I don't know where they are, but I do know that I have to leave the cave, so I need to get as much information as I can. The first group is anxiety, fear of the unknown, and it paralyzes. But when you give the gift of information, you then create the hero empowering power of fear, healthy fear, where they know what they're facing, they're ready to be armed for the fight, and they're ready to go forward. I have not seen a single patient in 30 years that, when duly informed, didn't rise to the occasion and make excellent decisions, especially when you respect the autonomy of the patient. When someone is told they have the diagnosis of cancer, it's not like HIV, it's not like a heart attack. There's nothing quite like it, because it's hard to see, yet it's easy to feel. It can spread through the entire body. It mimics normal cells, and it conjures up images of hair loss and nausea and vomiting and pain and death. It's extremely frightening. The gift you give your patients and their loved ones is comprehensive information. And when tumor is a rumor and cancer and the answer strikes out to do that, as you pointed out earlier by reviewing some of the chapters. Oncologists do a good job, but the literature continually shows that we need more and more and more teaching to reach out psychosocially as well as intellectually to our patients. Then compliance is better, survival is improved, and the overall quality of life of the patients is greatly improved. With the volume of patients expected to be seen in the average practice today, even with the oncology nurses who are winged wonders, they're simply angels, we don't have enough time to do all of this. Thus, the book.
The book answers all the questions. When tumor is the rumor and cancer is the answer. Dr. Kevin Ryan, the author, is our guest on the program. The book is available at Amazon.com. Information, of course, at our website, thisweekinamerica.us. And yeah, if I would pull just a couple of words out to describe the book, knowledge is one, and you've talked about that. And you mentioned autonomy, and that's something you really talk about as a crucial weapon in the battle against cancer. Talk a little bit more about autonomy and what exactly you mean by that, because as a patient, we really control our own destiny.
Absolutely. The informed patient is a very, very powerful tool in fighting a cancer. Autonomy has been ruled on a number of times by the Supreme Court, and they made it very clear that it's the right of the patient to decide their own, with freedom, decide their own fate medically. Now, of course, doctors will know more about medicine than the patient will, and they can improve the patient's knowledge by teaching them. But ultimately, it's the patient who is the one with the disease, who's self-enfranchised to make decisions, and will make them if they're given what the options are with good information by their physician. It's crucially important that the autonomy, the individuality, the right for free self-expression in the journey as they pass through this journey with cancer is respected. Otherwise, the patient becomes enfeebled, and they're not able to handle the journey at all.
You talk about getting the right information, and you say there's a difference between getting information you can understand and sterile clinical information. How difficult is it to eliminate that sterile clinical information that we so often get and really get something in terms that we can understand?
Well, I think the book demonstrates that it can be done.
Yes.
And I'm not alone. There are other providers out there. To be candid, a lot of it has to do with the personality of the providers and the personality of their nurses and the time allotted. But it starts, frankly, with compassion. Cancer is no respecter of persons, and there, by the grace of God, go I. It could easily be you. One of the stories that I write in the back of the book is about a very close personal friend who is a surgical oncologist who was diagnosed with a rare and difficult-to-treat skin cancer. And watching him go through the process was really very humbling and educational. It was quite an experience. So, again, reaching out to hold a hand, to hold a heart. Some are touching physicians, some are touching with their words. It matters not as long as you reach inside the fact that this is a frightened person who will respond more calmly to knowledge calmly given, with considerable sympathy as well as empathy for the pain and suffering, both psychologically and perhaps physically, that they're going through. It's really a simple formula of trying to imagine what it is to be in the shoes of another. Now, granted, that's going to be draining on the providers because you're making an emotional connection. But it's a decision you have to decide whether you're going to make or not as a provider, and then follow through with it once you have.
The book available at Amazon, When Tumor is the Rumor and Cancer is the Answer, a comprehensive text for newly diagnosed cancer patients and their families. Dr. Kevin Ryan, our guest on the program. How important is it the first couple of visits that you have with the patient? And I say that psychologically, they're probably at a place they've never been before. They've just heard the words that strike fear in all of us, cancer. And now they're trying to assimilate all this information, where they go from here. How important are those first couple of meetings with the oncologist?
Well, not to be flippant, you only get one chance to make a first impression,
right.
And you rarely get to recover when someone's already filled with such anxiety. So again, it's the same theme. It's extremely important. The setting when they arrive in the office, how they're treated by the front desk. That's why I wrote a chapter about the front desk, how the back office staff deals with them. That's why I wrote a chapter about that. How the nurses begin to approach and give them all of the information that the oncologist will not have time to give, and that's why I wrote about that. And how the oncologist has to make decisions about how are they going to personally reach this very personal situation. And if it's impersonal when they do it, there's going to be problems down the road. You may have poor compliance on medication. You may have the patient falling into greater depths of fear and anxiety. They may begin to do worse. They may not participate in support groups. And they may actually have some physical problems as a result of not making a connection, an anchor, as if it were part of a family, to these people who are gathering as a team to save someone's life, or at least help them on the journey of this very frightening diagnosis.
What happens?
It's really simple stuff.
What happens if you feel the provider, you just don't have that connection, you don't have that rapport, you don't feel you're getting the answers that you should be getting? How do you deal through that?
First, read the book, and in addition, tell them. You may get a positive response, you may not. I spent an entire chapter on what makes a medical oncologist. Who are they? What are their personalities? Orthopedists are very similar. Family practitioners are very similar to themselves. Medical oncologists are very similar to themselves as a group, whether they choose to admit it or not. There's a lot of common threads. If you cannot connect, then very politely you need to collect all of your medical records. All means all. Everything. The slides, the x-rays, the notes. Get a referral from the provider, or if not, contact the closest university and ask to be seen at the cancer center. And tell them when you get there, I just couldn't connect with my doctor. It's so crucially important I connect with my doctor here. Again, that's autonomy, and you have to empower patients to be able to execute those kinds of decisions. So yes, it's okay to move on.
We've talked about this before, and you talk about it a great deal in the book, When Tumor is the Rumor and Cancer is the Answer. How important is the right mindset? I mean, can you actually, does that help you in the whole process?
You're hitting all the great questions here. The chapter about a recipe for a sweet life, which is in the very beginning of the book, and it's called Read the Directions First, precisely goes after that. It talks about getting yourself in the right mindset. The chapters on self-talk and spirituality also go after that. If you give enough excellent information and you show the simple milk of human kindness, and you don't leave a lot of holes in terms of what's going on and why, as well as when it will occur, you're going to see patients respond very positively.
The book is called When Tumor is the Rumor, Cancer is the Answer, a comprehensive text for newly diagnosed cancer patients and their families. Dr. Kevin Ryan, our guest on the program. The book is available at Amazon.com. Time going by way too quickly in the program. I know we'll do some follow-up programs on this. In talking about in the very beginning stages, you're working with the provider, you're determining the treatment, and you've got broken down very nicely all the different types of treatment available out there. In fact, if you want to consider alternative treatments as well.
Yes, I have a chapter on complementary and alternative medicine because at least 30 to 40% of patients will at least look into that. And of course, it's extremely important to remember that these are not FDA-approved treatments. They do not have to prove that they are safe and effective. It doesn't mean that all of them are not. It means that you don't know whether they are. You also don't know if they interact with conventionally approved, proven therapy. So again, instead of shaking fingers and shaking heads, the important thing to do is to have a comprehensive approach to trying to understand what is the patient considering going on, educating them about that, and sharing with them the wealth of information that's available about whatever therapy that they're considering doing. When they're fully informed as to what's known and not known and what's supposed or what's just simply in vogue but unproven, patients generally gravitate towards the appropriate approved types of therapy. Nonetheless, the National Cancer Institute, National Institutes of Health, has an entire institute on complementary and alternative medicine precisely to try and find the truth. Remember, included in that is Tai Chi and acupuncture and hypnosis and self-talk and biofeedback and yoga. These are very good things for the psychological and spiritual milieu of the patients. But when we start talking about things that are substances being ingested, then we have to be very careful. We don't want to miss something that might have promise by not putting it through clinical trials, and we don't want to be ingesting something that either competes with known, proven, effective therapies or is substituted for known, proven, effective therapies. So it takes some artistry to know what your patients are finding out there on the Internet.
Couple minutes left in the program, and that was going to be my next question. Internet is the source of great information. It's a source also of great consternation. As you read things, you're not quite sure the source, if this is something valid. How does one use the Internet to their advantage and avoid things on the Internet that aren't true?
Very carefully, and start with the National Cancer Institute, 1-800-for-Cancer. Start with them. They have superb, organized sites by every cancer and every type of therapy. Read the book. That's authoritative. It doesn't lead people astray.
And you've got some great sites in there that people can go to and get information.
Yes, we do. And talk to your provider and bring to them your concerns. If they don't want to talk to you, then you might have a hint that you might need to go to another provider. But if they do spend the time, then you really have somebody who's interested in your well-being. Obviously, personal written anecdotes, stories of zealots, unproven therapies, on their face should be really discarded. But when you go to authoritative sources that are willing to discuss what is new in complementary and alternative medicine and what has been proven and disproven, then you're on to the right type of sites, and they'll be self-apparent.
Couple minutes left in the show. The book is When Tumor is the Rumor and Cancer is the Answer. Dr. Kevin Ryan, our guest on the program. The book is available at Amazon. As you're sitting in there initially, you're sort of scoping out the patient, how you're going to approach They're scoping out the relationship they have with you, the provider, the person that's going to take them by the hand and walk them through this journey. As you're going through that, and they're asking you the common questions: Will I lose my hair? How sick will I be? Will I be able to work? Do you handle that? How do you handle that?
You have eventually, to a large extent, a routine that applies to all patients, while you, of course, individualize their care and their approach. And your nurses are going to be crucially important with walking them through with comprehensive teaching. If a practice exists where the nurses are not doing comprehensive teaching of the patient, you've got a problem, and you might have to look elsewhere, because there is a great deal that's in common for all patients that will cover the majority, not all, as people are individuals, of what the patient needs to know. If that type of teaching is not occurring, complemented by what the oncologist is doing, then I would suggest you have less than a comprehensive practice, and you might want to consider elsewhere. Many of the universities have very in-depth patient teaching programs that go through all of those types of questions that come up again and again.
The book is When Tumor is the Rumor and Cancer is the Answer, a comprehensive, and it really is, text for newly diagnosed cancer patients and their families. Dr. Kevin Ryan has been our guest on the program. We will have him back because so much more to talk about. And that's another word that's mentioned frequently in the book, and that's team. You really see everybody that's working together as a team, and you don't probably think of that going in, but it's more than just you and the doctor sitting there. It's a whole team of people behind the doctor that's, again, going with you through this experience.
That's exactly right. It's that wonderful feeling when people grab an oar and all pull together and help the patient lovingly ashore. That's one of the lines that I use in the book, and it really says it so well. You're trying to ground them on some type of stable rock, even if it's small, from which they can be the master of their fate and future under the watchful and guiding hands of their oncology team.
The book is excellent. When Tumor is the Rumor and Cancer is the Answer, available at Amazon.com. It walks you through the entire cancer experience, whether you were a family member or you're the one that's actually going through the experience. So much more to talk about. We'll have Dr. Ryan back on future programs. Doctor, congratulations on an excellent book. Thank you for joining us on the program.
Thank you. You did a great job in helping us get this out there to the millions of people.
Well, it's important information, and you're the one that did all the work. So we're just getting it out to people because it's information that people really need, because most of us at some point in our lives will be dealing with a family member or dealing with it personally, dealing with one of the cancer diseases. Thank you again for joining us, and thank you for listening, everybody, This Week in America on the Blue Funk Broadcasting Radio Network.